I'm Jamie Eason, and I'm here with top plastic surgeon, Dr. Michael Ciaravino. Hi, doctor, how are you?
Hi, Jamie.
I am just going to jump right in.
All right.
I work in fitness, and I work with a lot of women who post-pregnancy, they reach their fitness goals, they lose all the weight, yet they still have these trouble spots, sagging skin, things that are just drooping and didn't go back to where they hoped. What are options for women like this, and what are the most common procedures that they might have done?
Well, that's a great question, Jamie, and of course we see many women after pregnancy who come to us in hopes of helping them get their pre-pregnancy body back. And there's a variety of plastic surgery procedures that are available, and we've coined the term kind of mommy makeover. Essentially, these are a variety of procedures that will help tighten skin, raise sagging breast, and reverse the changes that have occurred with pregnancy.
It's shocking how much change actually occurs, even with just one that I've had.
Right. So typically these procedures are geared towards the breast and abdomen area, where, as you know, we see the most significant change. So commonly women see their breast enlarge during pregnancy and then lose volume and sag.
Right.
So when we see these women back, we're having to determine whether they would benefit most from a breast implant to restore volume, or some need an actual breast lift to move up the nipple and tighten the skin. And in many instances, it's a combination of the two.
Gotcha.
Okay. At the abdomen, of course, it's very common to see excess loose skin. And we also see a tendency for the abdominal wall to stretch, the muscles to relax. And the fancy name for that is erectus diastasis.
Right.
So as you mentioned, we always encourage women to do what they can on their own with healthy diet, solid exercise, but there's only so much you can do. As you know, very little could be done about loose skin, and that's where plastic surgeons come in.
Yeah, that's why I'm so thrilled to have you with me today, because I think some women feel like, they don't want to resort to that, but I mean, I can tell you they're super unhappy. I've helped them get as lean as they can possibly get, yet they really still have these serious trouble spots. So I know some of them are considering it, but they just don't really know what all they can do, if everything is surgery or if there's other options for different areas. But now, once a woman has a baby, how soon can she have any sort of surgery?
Well, usually we suggest that a woman who's breastfeeding waits till she's completed breastfeeding, okay, for one thing, because she would not want to go through any type of surgery that requires anesthesia, pain medication that possibly could be passed to the child. And then the other reason for delaying is we want them to get back to a stable state. So usually this is a few months after their pregnancy, from 3 months up to a year is often a good kind of rough guideline.
It took me almost a year, surprisingly.
Well, it's taken 9 months to get this way, so it's not surprising that it takes long to bounce back, and even someone as dedicated as yourself. By the way, you look fabulous.
Thank you. Black is slimming.
So we like women to get back toward their baseline. And what I love about working with fitness people is I know they're dedicated. I know they're doing what they can do, but it can only go so far. And it's rewarding to me to know that we have procedures to take them to the next level and help tighten the skin, help lift the breast.
Well, that's all fantastic information. I hope, and I'm sure actually, it's helped a lot of women out there. So thank you so much, doctor. And if you'd like more information about any procedures that we've mentioned, please check out thebodydoc.com.